So now I think going to the next segment, we will have patient and advocate involvement in gynecology via community advisory board. This is a very important topic, and I think many of the people wanted to know more about community advisory boards. How to just promote the advocacy. So I think we have the Diane as a co-chair, and she's an expert in this area and contributed immensely to this. So I'd like to call Diane to take this next session forward. So please.
Yes, thank you. Thank you so much. Good afternoon. Good morning, everyone. Thank you for joining us for this very important conversation on patient and advocate involvement in gynecologic oncology via community advisory boards, or CABs, as we know them. I, again, am Diane Crawford, and I'm the executive director of the Crawford Crew. We are a nonprofit based in Ohio, and our mission is to end HPV-related cancers. And I also serve and have been serving as the co-chair for this summit, which has been a wonderful experience for me. Today, we're going to take a deep dive into what CABs are, why they matter, and how they can be applied in your communities. To do this, I'm joined by three incredible panelists from Ohio, each bringing a unique perspective on CABs. First of all, we have Sherry White, and Sherry is a member of the Case Comprehensive Cancer Center, CAB, and she will share her experience as a member from the perspective of being a survivor, a thriver, and a patient advocate. So hello, Sherry. We also have Christina Austin. Chris is a member of the Case Comprehensive Cancer Center, CAB, as well, and she will share her organizational and managerial experience with us today. Hello, Chris. And then we also have with us Dr. Electra Paskett. Dr. Paskett joins us today from the Ohio State University Comprehensive Cancer Center and the James Cancer Hospital. For today's talk, she will share her expertise as a clinical trial researcher, a survivor and thriver, and the critical importance of CABs as their contributions to advancing research. So, hello. So everyone, our session for the next 30 minutes or so will flow as follows. Each panelist will introduce themselves and their connection to the CABs. Then I'll give a short overview of CABs and how they work. And from there, we'll move into just a casual chat, like a fireside or breakfast chat, with back and forth discussion with our panelists, where I will pose questions and we will look for their perspective and their expertise to share with us. We'll leave time for your questions at the end, and we'll wrap up with some final takeaways about how you can apply the CAB model in our discussion today locally. So let's get started with Sherry. Sherry, would you mind kicking us off with introducing yourself, please?
Absolutely. Good morning, everyone. Well, I come from a background of healthcare administration and operations. And in 2011, I was diagnosed with breast cancer, a moment where my professional and personal worlds collided. Out of that experience, I founded My Sister's Keeper Cleveland, a support group, a nonprofit to support women facing any form of cancer with community and connection. For the past few years, I have served on the Case Comprehensive Cancer Center Community Advisory Board, bringing in the perspective of a patient, an advocate, and also a community-based organization.
Thank you so much, Sherry. So grateful that you're here with us today to share your experiences. Now let's, Christina. Chris, can we hear from you next? Can you tell us a little bit about yourself?
Yes, I'd be happy to. Thanks so much. And I really appreciate the opportunity to be on this panel today. So thank you to IGCS for this opportunity. I am the Director of Community Engagement at the Case Comprehensive Cancer Center, and part of that responsibility is to coordinate the efforts of our Community Advisory Board. Before coming to Case Western Reserve University, I worked in a community cancer support center and served for a number of years as the representative for a community advisory board from our organization. So I'm very excited to be able to talk about that perspective as far as how to support a community advisory board. So thank you.
Wonderful. Thank you for joining us today. Dr. Paskett, could you please introduce yourself?
Sure. Thank you for including me, and thank you for having this such important summit today. As I mentioned, I'm Electra Paskett. I'm a professor and director of division of cancer prevention and control in the College of Medicine. And I also have some other roles in the Cancer Center, but I also, like Chris, I direct our community outreach and engagement office here at the Comprehensive Cancer Center, Ohio State University. Di also mentioned I'm a cancer survivor. I'm a 3-time breast cancer survivor. Was first diagnosed when I was 40 years old. And my mother also had cancer 4 times. She survived cervical cancer, 2 breast cancers, and pancreatic cancer killed her at 86. So cancer really is my passion, personally as well as professionally.
Wonderful. Thank you so much. I hope everyone agrees with me when I say that we do have an amazing panel here of experts, and they're going to bring something unique from their own world. So what I'd like to do before we dive into this discussion, I want to quickly ground us in what we mean when we talk about community advisory boards. So CABs are groups that bring together patients, survivors, caregivers, clinicians, researchers, and community leaders, all very important to the success of a CAB. They advise and collaborate on projects that affect patient care, research, and outcomes. The goal is to make sure the patient and community voice is central, not an afterthought, in how we approach gynecologic cancers or gynecologic oncology. CABs can influence everything from program design to clinical trials, helping ensure research is more relevant, accessible, and equitable. And with that in mind, as we speak with these ladies today, we're going to hear from them, their experiences, and we're also going to hear a little bit more about the importance of CABs and how you can implement a CAB in your own area, in your community. So with that, Sherry, back to you. I would love to start with you. And as a survivor and a member of CASE Comprehensive Cancer Center Community Advisory Board, can you share with us what motivated you to get involved with this work? Obviously, your introduction leads a little bit to what you're going to share, but we would love to hear what motivated you to get into this work.
Absolutely. Thank you. Thank you. Well, as a survivor, a thriver, a warrior, I understand how isolating and overwhelming a diagnosis can be. I joined the CAB because I wanted to ensure that the realities of patients like me were represented in discussions or decisions about research and in community program. I also saw this as an impact and operation perspective when recruiting for clinical trials and research, for example. There was often a disconnect between what is being asked of patients and what patients were actually experiencing. So for me, joining the CAB was about bridging that gap, turning my lived experience into advocacy and making the process more patient-centered so others wouldn't have to navigate those same barriers.
That's wonderful. Thank you, Sherry. So from your experience, how has survivors like yourself at the table changed the way that research teams, organizations approach their work, in your opinion and your experience?
Yes, well, having a patient's voice shifts the conversations from being purely clinical into being more purely human-centered. When survivors are at the table, researchers and research teams are reminded that behind every data point is a person, is a family, is a community. And as a founder of a community-based organization that supports women during their cancer treatment, I also see that the disconnect between research design and real-life patient experience are present. And so bringing that perspective forward has helped projects expand beyond clinical outcomes to address access, equity, mental health, and the day-to-day realities of treatment. These lands push the organizations to design studies and programs that are more responsive, more inclusive, and ultimately more impactful.
I love that you said that behind the data is a person, behind every aspect. And that is wonderful and very powerful message. I think many patients, they probably wonder if their voice really matters. And based on what you've just shared with us and your story, it absolutely does matter. And it's critical to the success of the research also. So again, thank you. I'm going to jump over to Christina now. And Chris, now, once survivors are ready to get involved in the CAB and they're aware of a CAB, the next challenge is making sure the CABs are structured and run effectively. So from your view, Chris, as the Director of Community Engagement at Cave Comprehensive Cancer Center, what are some best practices you see for building and maintaining an effective CAB? Can you share that with us, please?
Yes, I'd love to. And thank you so much for that question. And
Oh, you just went to mute. There you go.
yep, someone meet. I think it's important to note that when we talk about a community advisory board, survivors are a part of that community advisory board, but it's also individuals that are working in other community organizations that represent individuals that have been impacted by a cancer diagnosis, but also other community members that are individuals who need to have education, who need to have screenings. And it's this entire opportunity to bring together the research community and the lay community so that there is this bi-directional conversation that's taking place. And so what's really important is to look at what type of representation you have on your community advisory board so that your community advisory board reflects the diversity of the communities that you are serving through your cancer center, as well as providing opportunities to help the researchers that are a part of the community advisory board to have that opportunity to engage with those individuals that are representing the community, either through organizations or as survivors. So having that foundation for what your community advisory board looks like is extremely important, and making sure that the community advisory board is contributing to the work of the cancer center, but also considering how, as a cancer center, are you supporting those community advisory board members in the work that they are doing in their own organizations and what they're able to provide to the communities that they are serving through their organizations. And so making sure that there's a balance between what's being given and also what's being offered, and that you're making sure that you are maximizing the time that those individuals are contributing to your community advisory board, because often they're volunteering their time. So when you set up the meetings, how frequent the meetings are is very important. And then making sure that the information that's being brought before the community advisory board is substantive, and that the community advisory board has a very clear understanding of what's being asked of them and how their participation can provide impact for the research that's being done.
Wonderful. Well, in that, what you just shared, there's obviously some challenges. You noted, you didn't say these are definitely challenges, but there's definitely challenges that are faced. So can you share what's the toughest part of keeping a CAB engaged and balanced, and how do you address those challenges, even though you did touch a little bit on that a moment ago? Can you share?
Sure, I'd be happy to. So I think it's interesting. You said, what are some of the challenges around keeping the CAB engaged? Mm-hmm. And I would say that is not a challenge.
Oh, wonderful.
Keeping the CAB engaged, because the individuals who choose to serve on a community advisory board are very passionate and interested with regards to advocacy and maintaining the community voice in research. I think what a challenge might be is the balance with regards to how a community advisory board is utilized within a cancer center, and just making sure that you balance out the amount of time that a community advisory board is giving. Because once a community advisory board is seen as helpful and responsive, everyone wants to have access to that community advisory board. So taking a look at how you manage how that advisory board is being implemented and the time that's being given by each of those individuals is very important. So that's why you want to also consider the makeup of your advisory board, the number of people that you have on your advisory board, so that you don't overburden the individuals that are giving of their time.
That's great. So that is from the cancer institution perspective, that they found out how great the CAB is doing, and they want to utilize those folks in other areas. Correct? That's a
It-
challenge to manage
yes.
that. Okay, wonderful. Great insights, great information for everyone to take away with them. It really shows the structure is key. It's very important, obviously, just as important as the passion when it comes to the CABs. We have to have a good structure and a foundation. So now what I'd like to do is, Electra, Dr. Peskin, let's bring in the research perspective, okay? So CABs have had a big impact on clinical trials, and we would love for you to share how CAB input has influenced trial design or implementation in the work that you've been doing.
Yes, thanks.
Mhm.
So all of my work for the past 30 plus years has had input from the community. And virtually every single study I've done has a community advisory board, as well as at our cancer center, we have a community advisory board like Chris just mentioned. The community advisory board, I'm going to now talk about specific studies. They tell us how to reach the populations we want to reach, to include in the study, how to best inform them, and that includes, looking at our materials to make sure that the literacy level is appropriate, and then how best to assess our work or our interventions in the communities. So community advisory boards help us with recruitment strategies. So when I was in North Carolina, we were trying to recruit for a prostate cancer trial among Black men. And they said, oh, you got to get Coach Gaines. He's the basketball coach at Winston-Salem State. And men would come and we'd say, how'd you learn about the study? Well, if Coach Gaines said it's an okay study, I'm going to join. They also, in my work in Appalachia, which is a low-income mountainous region in our state, we learned from the community that that we can't give the comparison group nothing. There is no absolute control group. You always have to give the community something. So all of our studies we designed that have something that we're comparing our intervention to. And then for many, many, many studies, they help us choose colors, they help us choose a study logo, they help us choose pictures when we're doing advertising. And I already mentioned they read everything to make sure that the reading level is appropriate. And you might think that these are simple things that we as researchers should know, but we always have to get the input from the community because we don't live in their shoes, and we have to make sure that it's appropriate to them.
Wonderful, wonderful. Thank you. Can you also think of an example where patient feedback through a CAB actually changed the way a study was done or helped make it more accessible to participants? Is there an example you could share with us?
Yeah, do you mind if I give you two? I'll be quick. So the first is the Women's Health Initiative. That's the largest study ever done in the U.S. on postmenopausal women. We recruited 160,000 women. And we had a goal to include 18%, 20% minority women. And when we were looking at accrual for the hormone replacement trial, we wanted to see if hormone replacement trial caused breast cancer, that we actually saw that there was a disproportionate amount of Black, Hispanic women who were ineligible due to body weight. And so we looked and there was no really safety issue. So we were able to change eligibility criteria and thus enroll more participants. So we heard that from the women that they wanted to be part of this study. So how could we make that happen? The second really explained to me why it's so important to get the community input. When I came to Ohio in 2002, I saw that cervical cancer was very high in the Appalachian area of Ohio, West Virginia, Kentucky, highest in the US in terms of death rates. So we wrote a grant and it was called Reducing Cervical Cancer in Appalachia. Got the grant, big $1 million grant. We go to the community and they said, oh, no, no, no. We don't say cancer. You cannot use the word cancer. You don't say the word cervix because, our girls, they don't have sex. So you can use the word cervical cancer in our research. So how did we do our research? And I'll tell you, we're now on our third iteration of this big research program. We worked with the community to help us use the words that could get us into the community and study HPV vaccination, cervical screening, etc.
Yes, and that's I think that research that you all have conducted, and just that simple way to communicate to the community is key, and the terminology is key in so many ways. So thank you for sharing that. I think just the conversation around the research has really highlighted how CABs can move research from being researcher driven to truly patient centered. And I think that's something that we can all take to heart, and know that it's very important to focus on the patients and putting them at the forefront of everything that we do when it comes to the research. We do have, just before we go into a group discussion, I wanted to note there's a couple questions. One of the questions that came through in the chat asked if those serving on CABs are compensated. And Sherry or Chris, and Sherry, do you want to comment on that? Or I can, Chris, whoever would like to jump in there and answer that question for our group.
So I'm happy to answer that question. Some CABs are able to compensate their members, and that's actually something that we are looking at Case Comprehensive Cancer Center. One of the things that we do consider that is kind of an outlier from a community advisory board is that sometimes individual researchers will ask to work with a community advisory board member. And when I say work with them, it means having that individual on their research team as part of their grant study. And so one of the things that we do encourage our researchers, and it's important for them to consider, is that when you have an individual, a community member that's serving on your research team, that you look at providing compensation in that research budget, just like you would any of the other team members. And so that's an important component of the discussions that we have with our researchers when they are initially applying for those grants and looking to have a member of the community on their team.
Wonderful. And I know it's sometimes difficult to follow the chat when we're all involved with conversation, but I see Dr. Pesquet, you also shared some feedback in the chat.
Yeah, so we do provide annual stipends, and it's based on the percentage of meetings they attend. And then if we're having an in-person meeting, we provide lunch. And then if it's not a meeting that's like in Appalachia, we go there. But like we just had a meeting the other day and people came to us, so we will reimburse mileage for travel to the meeting.
Wonderful. Okay, great. There's another question in the chat that I think it was Dr. Pesquet also brought up about Krista, who is a nurse who's on the call with us. Thank you for the question here. She asked about if you had genetic testing.
Yes, I've had everything done, all negative.
All negative.
Every time they get a new test, they ask me to give some blood.
Okay, thank you. All right, so let's open this conversation to all three of you. And looking ahead, what do you see as the biggest opportunities for CABs in the U.S. and worldwide? And Sherry, we can start with you.
Oh, I just see a worldwide collaborative, if you will. I will tell you that under Chris's purview, Chris has introduced us to so much through the CAB. I think that we're a part of creating research now, when ultimately it was the researchers creating research. But now through the CAB, we're able to come, hey, there's this wonderful idea that we want to test based off the population that we serve and what we see in the community. And this is a way for us to also do bidirectional engagement, as Chris, is a language we say within the CAB. We can bring ideas to researchers and then bridge that gap as well. So it's not just one way. So I see that as being a wave of the future, and that is a good way to include and make sure that there's no gaps when it's trying to recruit, patients for clinical trials, because there's always an issue with that. But if we're recruiting and doing trials or research based on something that's relevant to the community, we won't see that gap. So that's where I see us.
I love that. And that goes to show you how powerful the voices are in the community and how they're brought through the CAB. Chris, anything additional you would like to add?
Sure, I would love to. I think in the United States, the National Cancer Institute really encourages the cancer centers to have a community advisory board because of the way that they're able to help have that conversation between researchers and the community and bring both those lenses to the work that's being done. So when you consider the number of cancer centers across the United States having community advisory boards, there's been some conversation with regards to providing opportunities where community advisory board members are able to connect across the United States so that they can learn from each other, so that there can be more conversation around advocacy and how do we help our community advisory board members to become more versed in advocacy. So I see that as something as a wonderful opportunity for the future.
Great, wonderful. Dr. Pesquet, do you have one of the biggest opportunities that you want to share?
Well, I think the community advisory boards can teach us, not only, as Sherry said, what we need to research, but how to research and what strengths the community has. Because the community has so many strengths. And we, the researchers, need to work with the community to leverage both of our strengths together. Because, that's the only way we're going to conquer this cancer beast,
right,
is working together.
Agreed. So on the flip side, what are potential challenges communities may face if they want to implement a CAB, and how can they overcome those challenges? We can go back. Let's start with you, Dr. Pesquet.
Yeah, so I would say consistency. So one of the things that I think has made us have the success that we have in the rural and Appalachian areas is that we're there. We've been there since 2002. We don't helicopter in and out. We're always there, regardless of having funded grants. We are always there. And we're not there just asking for us. We will help the community. And we've written over 50 little grants for the community. Our community advisory boards, they have 501c3s, so they can receive grant funding. We help them write grants. We help them with any types of things that they need help with. And I think that's a mutually beneficial relationship. And so I would say consistency and make it a mutually beneficial relationship.
Okay. Chris, do you want to add to that as far as any challenges that the communities might face?
I think I definitely agree with what Dr. Pesquet is saying with regards to consistency. And even before the consistency, it's about relationships and relationship building. And that is very important, so that it's not transactional, but that there is a relationship, and using Dr. Pesquet's words about it being mutually beneficial. So I think before saying, hey, let's have this community advisory board, to really sit down and think about what is the what's the foundation of that board? What are the goals for that community advisory board? What do you want the outcomes to be, and what can you actually commit? And looking at, what does compensation look like? Because we have a large community advisory board that speaks to the entire cancer center, but when we are doing smaller projects within communities, then we will have a advisory board that's specific to that particular community and the research that's being done, and definitely looking at providing compensation for that individual's time, but looking at what is this going to look like for the long term, and setting up a plan to be able to speak to that long term.
Something you mentioned about having a large advisory board. That's a good question. Is there a good number that we should recommend? have 5 on the advisory board or 55? Is there any, in your experience, any goal there for how many people should be on the board?
I think it really speaks to what your goals are as an organization. What is it that you want that community advisory board to be able to do? What's the capacity of the individuals that are on the community advisory board? So being very mindful and very thoughtful about what the expectations are for the board and the responsibilities that you're asking of them. And then I think that helps to dictate the number. So you can't say that there is a set number. It really speaks to the individual organizations.
I would like to interject, though. I do agree with what Chris is saying, but a minimum of 12 to 15 minimal, because not everybody will show up every time. And you don't just want 5 people there or 4 people. So I think, 12 is a good number to start with, but you have to represent all facets
Right.
of your community. So you hear all the voices together.
Yes. Okay. Thank you. And then I wanted to jump over, Sherry, to you real quick, as well as any potential challenge the community, your experience that the community may face.
So
Haven't touched on.
the challenge from my perspective as being a member is kind of what Chris spoke to, trying to narrow down what we can do. So I think coming in as a person or organization that wants to impact in a positive way in the community as it relates to their awareness and the mitigation of cancer, not only down to our scope, because we're going in full guns blazing. We want to go and we want to move forward. So I think that just having that basic structure help calm us down because we're very excited. And then one of the things that wasn't mentioned is within the community advisory board, we have so many different members, but this also creates another opportunity for us to be more impactful as a community because the community-based organizations, the survivors, and also the Case Comprehensive Cancer Center are now working as a collective community, and our reach has spread it a little bit bigger. And the work that we create together also hits the masses, and if you will. So that's one aspect that we haven't really spoke about that I think is beneficial. And I will also add about the compensation aspect. And so within our CAB, we had a heavy debate about compensation. So for me, as a community-based organization, I think I get better, it's more of value to me to be able to impact research, to be able to bring those ideas and bring that voice to the table. So it's not necessarily monetary, although we do love the food when we meet in person. But there's more to it than dollars.
Thank you. Thank you all so much. So we've got the chat is kind of blowing up a little bit here with some questions. So that means everybody is very interested in what you all are talking about and sharing. I'd like to turn this over to our participants, to our audience, and what questions they have for our panelists. So I'm gonna actually ask Shira, if you chime in too, Shira, if I've missed any here, but I wanted to look and see at the chat real quick. There's a lot of great comments, but I want to see if there's any direct questions. What do you find to be the most surprising in the educational exchange of all these stakeholders coming together? Anything you have found clinicians have been surprised by, or vice versa? That's coming from Shira from IGCS.
I can just say one thing. We just formed a new community coalition. It's actually called the Collaborative because it represents a rather large area in Southeast Ohio. And so we did a roundtable and asked everybody, what pressing areas they had and then we did an exercise in the group where we asked them to rank by importance, a whole listing, the whole listing. And if you would have asked the researchers, what would you like to initiate? I would have chosen cervical screening and HPV vaccination because A, we can do something about those two, and B, they're very high, as I mentioned, in that area. And the community chose environmental exposures and early onset cancers. those are extremely, extremely, extremely important. I'm not, saying they're not important, but there's very little we can do to change that other than inform. But that's what we're going to do. We're going to work through their listing because that's what's important for them and that's where they have the passion.
Thank you. Let's see here. Shira, help me if there's some up towards the top that I'm missing here. And if anybody has questions right now, they want to drop in the chat, that would be wonderful. We've got, I don't know, we've got maybe about eight more minutes or so.
Sure. I do see a comment, Diane, from Anisi. She says, I love the be there, not just helicopter in and out. This is the current situation with a lot of areas resulting in inconsistencies and no mutual benefits, so impact reach is minimal. So maybe if you all can kind of talk about that and maybe how if there is a way to minimize the helicoptering and kind of speak to that, or do people just get involved in terms of their commitment, their time, how much turnover really is there?
Thank you. So I was going to ask Dr. Pesquet, because I know that was one of the comments that you had made about being there, boots on the ground.
Yeah. So I think, you have to have a commitment to the community. So how do you grow that? That's something you have to have. You have to have a commitment to the community. If you have a commitment to the community, then you're going to be there. And that's sort of where I'm coming from. It also helps, Chris and I both, as we mentioned, direct the community outreach and engagement offices of our cancer centers. So these were not mandated in the U.S. cancer centers until a few years ago. But I think having these offices will also minimize the helicoptering because we now have staff that can facilitate such constant relationships with the community.
That's great. That's great. Thank you. Okay, here's another question that came in from Runci. It says, how can we encourage clinicians and researchers to include patients?
I think that is a great question. And part of that is the role of your community advisory board, having that opportunity for the community advisory board to connect and engage with your researchers, that those conversations, those relationships that you build with clinicians and researchers through the community advisory board helps them to really understand the importance of those connections. Because when they have those conversations with community advisory board members, they can themselves start to connect the dots and see what benefit they are gaining from having those conversations, and then thinking about, okay, what could this look like with my research if I'm having someone who is engaged on a regular basis? What are some of the different questions I might be asking? What are some of the different perspectives? But I think they have to first have that experience of even having a conversation with a community member, because some researchers, they are in the lab and they're not necessarily connecting with individuals from the communities that they're trying to serve. So having those opportunities for that type of engagement helps to lead to further connection.
Wonderful. Thank you.
If I can add to that, and this kind of goes back to your question about what has surprised you. So I just want to call light to the idea that we are in a world where people come from different perspectives and have different ideas. And so I've worked with physicians and researchers since I was 15. So I understand their world. I understand how things can be more narrowed as it relates to different perspectives, because like you said, they're in a lab, they're focusing on a different aspect of life, while the community advisory board may be actually focusing on life, if you will. So they're focusing on the research. We're focusing on the real life aspects of it, and just bringing those two together, because I will tell you through a couple of experiences that we had where researchers came in and we're asking questions. Well, why are you giving more surveys to the patients? Didn't they do enough? Don't you need to survey the staff? But it's giving that idea, that voice to life, that different perspective that people in the research may not understand. just bringing that life aspect into it. And also for the community aspect of it, it helps us to understand the mindset of the researchers, and just bringing it together. So I think just calling attention that we think differently and appreciating those differences.
Yep, I love that. That's wonderful. That's great, great information for everybody. Again, we still have great questions coming through. One of them I wanted to point out is the question was asked, how do you choose who will be part of a CAB, like what their qualifications should be? How is the Cancer Center choosing those members? Dr. Pesquet, do you want to?
Yeah. So, and I'll roll that into the other question about difficult to keep a balance. So
Yes.
For qualifications, we do look for a balance. So in Ohio, we actually have an extremely diverse patient population across the entire state. So we try to engage people that represent each of the different population groups, and that sometimes gets to be difficult in terms of, maybe we want somebody from the northwest part of the state, that's 3 hours driving, or that's why we do virtual meetings, a lot. So that is a difficulty, but we sort of look for the expertise of the population that you will be speaking for, that that population, you work with that population, you are from that population, you have a lived experience of that population, and you bring that viewpoint together. We don't need people to be, PhDs, MDs. We just need them to have that experience.
Wonderful. Chris, do you want to add anything from your perspective?
No, I think Dr. Pasquette hit the nail on the head. Well, I will say being able to have a commitment, because I think individuals, you can be very excited about giving back or joining an initiative. So I think being very clear with individuals about what the expectations are up front, so that they are able to know if they can make that commitment or not.
Okay. Wonderful. Okay, so we need to start wrapping up here. Our time is about come to an end, but as we close, I would like to ask each of you panelists to leave with us one piece of advice. If someone here wants to start or strengthen a CAB in their own community, what's the one thing you recommend? And I'm going to start with you, Sherry.
Ooh. To share your voice, be willing to share. So many of us, when we're experiencing cancer or see a loved one with cancer, we feel that this is only our story and it doesn't have any power. But those stories, those voices does have power. I'm here today, and many of the survivors are here today because we shared our voice to increase the research that carries us on. So sharing our voice, our perspective, is very important.
Okay, thank you. Chris?
I would say in order to start this type of initiative, spend a good amount of time pulling together your plan and what you want this initiative to look like. And again, your outcomes, your goals, but be willing to and ready to build relationships, because that's really what a community advisory board is about. It's about relationships. And with those relationships comes trust. And with that trust, then you're able to continue to do phenomenal work.
Okay, Dr. Pesquet, what's your one piece of advice?
Respect. I think you need to respect everybody, and you need to respect everybody's viewpoint and everything that people say. And that means you have to listen and be genuine.
Well, these are wonderful, wonderful pieces of advice. And thank you all so very much. Today, I believe we've seen that CABs are more than just an advisory group. And for many people participating today, you may have never heard of a CAB before. And you're learning that they are platforms for elevating patient voices and for strengthening research and building stronger connections between communities in the medical field, which is critical, as we've talked about all day today. You know, we're in this together worldwide, so it's important for us to connect with the communities in the medical field on a daily basis. I'd like to thank our panelists, Sherry White, Christina Austin, and Dr. Electra Pesquet. Thank you all so much for sharing your expertise, your lived experience, your time with us. And I'd like to also thank everyone who's taken the time to be part of this conversation today. This has been wonderful. I hope you are inspired and that you are interested in moving forward with creating a CAB in your own community, using what you've learned to help you do that and help you be successful. And as a co-chair and a moderator today, again, I want to thank all of you so much again for being here. I've so enjoyed this, and to my panelists, you have been wonderful and very supportive with this session, and it's been a pleasure. So thank you again. Kudos to everyone involved.